Welcome back. It's time now to answer some of your medical questions. And joining us with the answers is News Channel 5's medical specialist, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks, as always, for coming in.
You're welcome. Good to see you.
Good to see you. We've got some good ones today. Our first question deals with something we're all feeling right now, really. What is the difference between heat exhaustion and heat stroke?
Yeah, there's, heat illness is a continuum, and heat exhaustion leads into heat stroke. And actually, this is a very important topic because there's a lot of vulnerable people out there, especially if you're over 65 or if you spend a lot of time in the sun working. And clearly, the differentiation is this. Heat exhaustion, you're still able to cool the body. If you still have fluid left in your body that allows you to sweat, then you are in heat exhaustion if you develop symptoms like cramping, weakness, nausea, headache, things like that. But what's happening is you're starting to become dehydrated and your body's temperature is starting to rise. It won't go above 104. Now, when you stop sweating because you become so severely dehydrated that your skin becomes dry, yet you're still out in the heat, now your temperature can rise above 105. You start to become confused, even unconscious. It can affect the internal organs and even lead to death. That's what heat stroke is, very serious. Know the signs and symptoms, prevent it from happening. Get in the cool, get in AC, get in the shade, and drink plenty of fluids.
Okay, so one's sort of the precursor to the other.
You bet. You're not going to go into one without having exhaustion first. Your body will follow along that progression.
Got it. All right, our next question. How can you tell, oh boy, we've all probably experienced this, how can you tell if you've severely just bruised a toe or if you've actually broken it?
Yeah, have you ever snubbed a toe? Yeah, it hurts. It hurts a lot. And you know what, it becomes bruised and it's swollen, and by looking at it, you're not going to be able to tell. The only way to reliably tell is if you get an x-ray. The good news, though, is that you're not really going to change anything. What we do for a broken toe versus a bruised toe is wrap it with another toe. That's considered the immobilization. We just call it buddy taping. The only benefit of knowing is that we're going to be able to tell you it's going to hurt for 3-4 weeks rather than it's a bruise, and it probably start to feel better in a week. You can walk on a broken toe just as easily as you can a bruised toe. It's just going to hurt, but it's not going to cause any damage.
Oh, and there's nothing worse than that pinky one.
That's right. It's always the pinky,
on the side of the dresser.
That's right.
All right. Our third question today. How old does a child have to be before you can give them painkillers?
Well, we recommend that no medications are given before age 2. Now, painkillers like Tylenol, ibuprofen, or even codeine or hydrocodone are all safe. They're all safe in children younger than 2. It's not the medication that prevents you from giving it. It's the dosing accuracy of which we want to make the determination of before we have you give it. Because they're so small and the concentration is so appropriate to the patient's weight that we want to make sure you give the right dose. Plus, their weight changes so rapidly that it can change from one visit to the next. We want to be the ones that give you that recommendation.
Got it.
Okay? So, and it also is important to know why you're giving it. If it's fever versus pain, it may change the dosage that we recommend.
All right. Great advice as always. Thanks.
You're very welcome.
If you've got a question for Dr. Soria, you can always send it in by going to our website, WPTV.com. Just click on that health link, scroll down to the right side, and you'll see a form where you can write in your question. Thanks, Dr. Soria, for coming in, and thank you for staying tuned until the other side of this break. We'll meet you there.